Hey y'all, today we're sitting down here with Dr. Dotson. Doc, how are we doing today?
Good, doing good, thanks.
Again, I just want to thank you for your time. I know you're super busy, but from the bottom
My
part of here at NxtEra, we are super grateful that you blessed us with this. We know there's a lot of other things you've been doing right now. To get going, do you mind just giving us a quick rundown where you went to school, who you are, how you got interested in the field, and how long you've been doing it for?
I'm from Virginia. I grew up in Tyboard area, Virginia Beach, Norfolk.
Okay.
My dad was an oral surgeon, so I wanted to go to dental school to be an oral surgeon like him. And ironically, I found out it was too hard to get into his profession of oral surgery, so I decided to go to medical school instead. But I went to high school in Suffolk. I went to college at University of Richmond, and then medical school at Eastern Virginia School in Norfolk. So it was high school, 4 years of college, 4 years of medical school. And then after that, I did my general surgery training, which is residency, which is 5 years. And then I did my specialty transplant fellowship, which is 2 years at the University of Pittsburgh.
So the total 7 years there.
7 years of training, 4 years of medical school, 4 years of college.
Okay. Funny story, my mom actually is from Suffolk.
Your mom's from Suffolk?
She lived, well, she was born other places, but she went all through high school in Suffolk. She gets it closed now, but it was a Catholic all-girls school maybe or something like that, just outside of town. I don't know the exact name, but yes, that's where she went to high school and everything.
I'm sure she knows my family. They've been there for forever. Yeah.
Both of her parents were in the Navy, and they were doctors in the Navy, and I think they were either stationed there or they were already out of station and they were working out of hospital there. Yeah. That's where she went to high school.
I'm sure they know my parents for knowing.
That's crazy. All right, can you just give us what an average day-to-day would look like for somebody in your field?
So my average day is start rounds at the hospital around 6:15. So I usually get up around 5:45. I'm in the hospital by 6:15, make rounds. You always have to make them early so you can get everything organized for the day.
Yes, sir.
Then either I have surgery or I have clinic after that. So I usually have surgery about 3 days a week and then clinic 2 days a week. So I try not to have both in one day, but that unfortunately happens because something always delays something and I'm, putting clinic off and or if people are late for I'm late for their appointments. So, but technically my day is, sometimes it's 10 to 12 hours. Sometimes it's around 6. It varies.
Just depending on the workload that you have that day.
And then I'm on call probably once a week. So you have to come to the emergency room. So you have to come in the middle of the night if somebody needs emergency surgery. It's only about 1 day a week. It's not bad.
So that's just one night a week, your phone's on all the time. If it rings, you're answering and going to work.
Well, my phone's on all the time for my other practice is what I do. But yes, for covering the year, that's the only time I really have to come in at night.
Okay.
Either that if I operated on somebody, there's a complication, which rarely occurs, but it can.
Okay, of course. Of course. So one thing we preach to our group is taking advantage of the opportunity to have in the time that's available as a homeschool family that you can really dive into your passions and dive into your future careers. Is there anything that you could suggest to some of our kids to help them be ahead of the curve so that when they do enter college, they're not feeling like they're playing catch up, rather they're one step ahead and they're kind of already rolling within it?
I think 2 things I'd recommend. One is volunteer.
Volunteer? Okay.
You can volunteer at a hospital. There's other volunteer opportunities for, nonprofit organizations, helping, the needy, that sort of things. That always helps. And I think it also gives you a vision of, hey, may I want to do this or I might want to do that. So volunteer, as much as you can. Staying busy during the summer working. Okay. I always look at a resume and I'm like, well, what'd you do that summer? Well, I'm kind of like, well, who paid for you? You know what I mean? I want to see, that you had some entrepreneurial skills. You went out and did stuff, even if it's, I was a carpenter in high school.
Oh, no way.
Yeah. So I built houses, I framed houses, I trimmed houses. So that's what I did in high school. So I'm always looking for that. I think in terms of class load, if you're thinking about medical school, then you have to emphasize physics, biology, and chemistry. Take as much as you can, as many advanced courses as you can to prepare you for college. But now there's all sorts of other professions that don't involve those courses. Of course, in medicine, such as, respiratory therapists. You can train for that out of high school. Ultrasound technician, train for that out of high school. There's radiology technician, train for that out of high school. You have to do, usually a 1 or 2 year.
So those are careers that don't require you to go to school. It's something as soon as you get done with, you can start getting into it.
Yep. Okay. Yeah. High school's all you need. And they pay very well. They do. There's so many of them that pay well. And then there's also the ones that require college, like nurse. Become a nurse is usually 4 years. Nurse anesthesiologist, you do 4 years, and then you have to do ICU for a couple of years, but then you do nurse anesthesia training. Pay extremely well and great lifestyle, great working environment. So there's so many opportunities that, I think a child should explore, getting out of high school if they want to get in healthcare. The first thing I think that's going to motivate you for healthcare is volunteering.
Okay.
If you volunteer, you'll see that, well, maybe I don't want to do this, or I really enjoy this. I enjoy the environment. It's a collegial environment, it involves teamwork, working together, it involves skills, and we all like to show off our skills whenever we can, right?
That's one of us, a part of the human experience.
That's right. It's human nature. So I think there's all sorts of opportunities. My situation is unique. I did probably the most training that anybody does in terms of medicine. But I was lucky. It taught me, I learned how to do transplants. I did transplants for 25 years, liver, kidney, pancreas transplants. I traveled all over the world. I did transplants in China.
Oh, no way.
I did them in Korea. I've actually gone to Africa and volunteered for, 2 weeks, did 100 surgeries. And
In 2 weeks?
Yeah.
No way.
My training allowed me to do these extra things. You know what I mean? And I never dreamed. I went way beyond my dreams. I was going to be a dentist like my father.
Yeah.
And I ended up doing stuff I never dreamed I'd do. I was very lucky. Very lucky.
Quick question now that you say that, because in our group we have everyone from super shy individuals to super outgoing individuals.
Yeah.
Do you think within the medical field, for what you just listed those things, different personalities will line up better with certain things, or is it kind of just get your foot in the door and see what you like?
I think all personalities will do well as long as you're willing to work hard if you like to learn. I love learning something new. And that was what attracted me about transplant. There was always a new drug coming along or a new procedure, or sometimes we just did a liver transplant. Next time we're in a patient, we were doing a liver and a pancreas in the same patient. So the field was always expanding, and I enjoyed that. And trust me, there's all sorts of personalities in medicine.
Is there really?
There's the shy, there's the aggressive, you know what I mean? They're all there. There's room for everybody in medicine. All you have to do is, I think, work hard, be considerate, and there's a place for you.
Okay.
So I really believe that.
All right. You kind of touched on the programs with the volunteering, and I know we kind of talked about before we started filming. You said they don't really have as much reading. It's now all videos. Is there anything where specifically that these people can go to and access some more knowledge so that way they can be, because one of the things we preach to our people is self-learning. You have to be able to go out there no matter what it is and get more information. Is there anywhere that you can point them to? If not, it's totally cool as well.
I would look up allied health professions.
Allied health professions.
And that'll give you a list of all the other professions. I didn't name them all.
Of course not. Yes, sir.
There's all sorts of other ones, allied health professions that, have, they don't have the training requirements in there. They don't have the job requirements, what you're going to do, those sort of things. So there's all sorts of opportunities in allied health professions. So.
Okay. I'll put a link in the video so that way they can just click right on and get to it.
That'd be great.
So, again, one of our biggest fears from the parents in our group is their ability for their kid to go out and socialize, because it's a common misconception that, you're homeschooled, you're not around a lot of people. Can you just stress the importance of being an effective communicator within your industry?
Well, I think it's very important. I was shy, you know what I mean? And that's one thing about medicine. You spend so much time studying, you know what I mean? You become kind of isolated. Yeah, you do. You become introverted in a way. But I think if I had to go back, I wish I had volunteered more.
Okay.
I wish I had gotten more involved in, clubs and associations in college. I didn't think I had time for it because I thought I had to study all the time.
Yeah.
And, it kind of limited my experience. And I think anytime you can get involved in something, and that volunteer work, I think, can be at a hospital, or it can be cleaning up the beach, or, you know what I mean? So many other opportunities are out there.
So you don't even think it has to be medical specific. It's about just getting yourself in the community, giving up some of your time for the better of everyone else, and getting out there.
Yes. I think there's all sorts of opportunities available to kids these days, but you have to go online and find them. And I think staying busy in the summertime, getting involved.
Okay.
I mean, also getting a job. I mean, even if it's working at the grocery store, you're going to be expected to work with a team. You're going to be expected to be cordial and all those sort of things. That's good training. And, when I look at that and I say on a resume, somebody's applying for medical school, oh, God, you worked at Publix. Yeah, I did that for 3 years. I'm like, I'm impressed. Yeah. And they're like, what? You're not impressed with my grades? I'm impressed with your grades because everybody else has grades like you. But you're one of the few guys that worked at Publix for 3 summers. You know what I mean? And I think that really speaks well of you. So those sort of things, I think, I think we've learned that they really help us in picking someone, you know what I mean, that they've gone out there and done stuff and
show that they're committed to put off that extra work, they're willing to put in that time and stuff for it. And you kind of touched on it, but if you could emphasize a little bit more, I would imagine in the medical field, working as a team, being able to be a leader if you're in the position that you are is going to be crucial for success. Can you just kind of let the people know like how important it is to be able to work with others, like actually talk with them and then have a good working relationship with everybody you're around?
Well, it's absolutely essential these days, especially we're all under the microscope and everything's transparent.
Of course.
But yes, I mean, you have to be a team player. You have to be respectful. And there are going to be times where you're tried, you know what I mean? And you're challenged to be that way. But I think if you always demand of yourself that you're always going to be your best, even in your worst times.
Okay.
So I think that's important to emphasize. I think another thing important to emphasize is going into medicine, you're going to have setbacks.
Okay.
You know what I mean? Going into any medical profession, you're going to have setbacks where, well, maybe I didn't get to the school I wanted to, or I didn't get into the program I wanted to. But as long as you work hard, create a good environment around you, and work in a collegial fashion, people will want to work with you.
Okay.
And your opportunities are going to expand.
Gotcha. Now, you said you were a little bit shy at the beginning. Was there anything that helped you open up? Or is it just more something once you got in there, some time, then you started to loosen up and be able to work with those people better?
Yeah, I think it was actually becoming more skilled and becoming more confident.
Actually in your skills yourself.
Yes. And I think some of us are kind of shy because we feel intimidated. We don't feel like those guys might be better than me.
Of course,
you know what I mean? I can't do as good a job as they can. So it causes us to withdraw. And I think I would emphasize to kids, okay, if you feel like someone's doing a better job, get more involved. Ask them how you can be helped, or, you know what I mean, who you can go to for assistance. Look for that person who will help you, and you'll find them along the way.
Of course. So, one of the things we actually say to people all the time is if you're going to be successful, you have to have the mindset of how can I, rather than why you can't. Right. And you saying right there, actually those people that you think are better, get up close to them, ask them how they learn their skills, what do they do, so you can acquire that information. Because at the end of the day, just like everything in life, it's a skill. It just takes time and rest. Right. Everything can be learned with it. So it's crazy you said that, because that's something that we actually preach all the time. We'll kind of move down to the health now. How important is it being healthy to be able to be successful, especially for someone in such a stressful environment like yourself?
Well, I think you have to take pride in yourself. I think that's very important. You have to eat right. I mean, you can't work all night and not be healthy and get up the next day after 2 hours sleep and then put in a full day. I used to do it all the time. Now I don't have to do it that often, but it's extremely important. I mean, you just have to take pride in yourself. Okay. I think in the way you live your life every day. And I think that's very important. Yes. No question about it.
Awesome. As of right now, I'm sure there's many different stressful parts of your job. Do you have anything that holds the highest level of stress during your day-to-day actions?
Yes, I do. Some of the surgeries I do are pretty intense.
I can imagine.
Sometimes we lose a patient. That's tough.
That has to be hard.
But even in the worst of times, I've got to keep my cool in the OR.
Yeah.
Because everyone's looking for me to lead. And, even if a patient's crashing, yelling, screaming, creating a difficult environment only makes it worse. So you have to learn how to keep your cool in the worst of times, and always be your best. And, so yes, we have, my most challenging moments have always been and will always be in the operating room with a really challenging case, because we're doing life and death surgery, especially when I was doing transplants all the time. I think the hardest job you'll ever have is to come out of a room and tell a family, unfortunately your loved one didn't make it. That's tough.
I can even imagine trying to.
But, you have to rise to the occasion where you felt like you did your best, but at the same time, look back at yourself in a very self-critical manner. What else could I have done to have changed this outcome? Okay. So I think that's very important to always look back and could I have made this outcome better? And I think the same thing holds true for, to try to get a medical school. Okay, why didn't I get in this year? Where was my defect? Was it my grades? Was it my MCAT scores? Was it my lack of involvement? So you have to look back at yourself when you've set goals for yourself, you're not quite achieving them, and say, okay, what could I have done better? And I think that keeps me motivated. I think you have to stay grounded. You have to always look at yourself in a critical manner. I teach a lot of residents. One thing I tell all of them is be your best critic. Be your best critic. Be the one that, not most critical, but when you can honestly look back in yourself and say, how could I have done this? Or I've got a problem. How can I fix it? So
that's just a matter of taking that time back and not being hard on yourself, but looking back of how can I improve? How can I get better?
Exactly.
And looking for that area of growth. Awesome. Now, you said something about breaking the news to the family. I could imagine that's one of the most mentally straining things to do. As a person in your position, how do you cope with that additional stress? Is it a matter of just, like you said, looking back and reflecting? Is it a matter of trying to push that away to the side? Is there anything that you do specifically to kind of help your mind? So I know when you enter the operating room the next time, you're not being held down by past thoughts. You're kind of ready to proceed forward.
Well, I think it usually takes about a week to get over a case like that.
Does it really?
Yeah, it takes about a week. I mean, you think about it every day. You think about it all the time. And it's happened to every surgeon. There's not a surgeon out there it hasn't happened to. I think, one, you have to look back again in a critical manner. What could I have changed anything?
Okay.
And I think you have to be willing to accept in yourself that, yes, you probably could have. And, you're not perfect.
No,
but, you could have made this better by doing this. So you learn for the next time.
Okay.
So you prevent that mistake the next time it can happen. So I think that's one thing that's very important. That's why I say you always have to look at yourself. And I think in not a terribly critical manner, but in a way, how can I make myself better?
Okay.
And I think that's what gets you through those difficult moments, because you're going to have them. You're going to have them in all of the allied professions. You're going to have them in, you're going to have them in surgery as well, medicine. I mean, nurses have patients die. Nurse anesthetists have patients die. Everybody that's been in the hospital has been around it at some time in their life. So,
of course,
it's tough, but I think that, you learn from it.
Okay.
I think that's what's most important.
I feel like, too, with the medical industry, you have to have, the heart of giving and being a servant. So I feel like those people also, when they're around that, they can take it even more harder because they have that, they're coming from the place of, I want to help you, I want to make you better. And then having that defeat could bring them down a little bit. But you're saying if you just stay, instead of being hard on yourself, just stay, how can I become better to minimize this from happening again? Perfect.
I think there's one other thing I want to say about medicine. That is, some people look at people and say, well, are they bridge owners or bridge dwellers? You know what I mean? I try to look at everybody that they're bridge owners.
Okay.
You know what I mean?
Yep.
Treat everybody with respect. Treat everybody the same, because, typically there's that, they might not have lived the best life, or, not have, lived an exemplary life. They're still sick.
Yep.
They still need care.
Yes, sir.
And you know what? There's always one person that loves them.
That's, I didn't even think about that. That's a great point.
There's always one person out there that loves that person, and that person means a lot too.
That's a great point.
Do your best for that one. So I think, being open-minded, I think is another way to be, is critical to being successful also.
Awesome. We're going to kind of run it back to the studies here with this question. Going through your regular university and then medical school, about how much time should the parents and the kids expect to dedicate towards studying, and actually from class to the at home, putting in that work at night? About how much time do you think they should dedicate to that?
Yeah, that's hard to answer. I think probably as much time as needed. That's not
that makes the most sense, though.
I mean, to go to medical school, you're going to have great grades. You're either able to handle the class load or you're not. And there's a pretty specified class load. So, I think most people find out somewhere along the way that, medical school probably isn't for me. I need to look at other things. In terms of how much time to study, I don't have the answer for that. I think everything now is graded nationally almost. You know what I mean? We take, SATs and all these things that are national. And I think it's important to look at your strengths and your weaknesses. Can I make my weaknesses better? And, what my strengths are, and what do they me that I should be looking at in terms of the future.
Yeah, I like what you said too about it takes as much time as you need. That's another thing we kind of stress to them because again, we're dealing with all homeschool families.
Yeah.
So sometimes the parents will be like, hey, should my kid, if it takes an hour, if we're structured for an hour of learning, but it only takes him 15 minutes, what do I do in that situation? And for me, especially when I was going through school, I learned, like you said, it takes as much time as necessary. If you can run through something in 15 minutes, we might as well use that 45 minutes to go learn something new.
Yeah.
Or if it takes you a little bit longer, instead of beating yourself up over it, go ahead and take however long you need so you really grasp that information and get a taint of it. The last question on this, would it be possible when somebody does get into school to be able to work and go to school? Or is this something they should be planning for financially to, hey, I'm going to dedicate my time to school only during this period?
I mean, it's hard. You can do that. For medical school, you're expected to take your medical college admissions tests. And it's a bunch of things all crammed in at once. Physics, biology, chemistry, organic chemistry, and you're expected to take it all at once. So it's really hard to spread things out over many years. I took physics 4 years ago. Now I'm taking my MCATs. So you it's nice to get them as close together as possible. Yes, but you can still work. There's people that have done it. I know a lot of people that have done it.
So it's possible, but it's a challenge. It's a challenge.
It takes a special person, but there's a lot of special people out there that do it.
Okay. And then just something I just thought was your answer there. With the MCAT, was there anything you did specifically to get prepared for, like Khan Academy or anything along those lines? Or was it more just you looked over all your past notes and kind of got ready for it? Did they have practice exams?
They have practice exams. I did take a class.
Okay.
Class really wasn't that helpful. Now I think the classes are much more helpful because they have a better idea of what's going to be on the exam and how the exam is structured. So I definitely recommend if you're going to do it, pick the time that you want to take it. Schedule your classes around that time, schedule your preparatory work.
Okay.
So that it all works out for you.
Okay.
So
last question here, then we'll wrap up. What were some things that you found that helped you succeed specifically within your industry?
I think motivation.
Motivation?
More than anything. And I think what motivated me was I like to learn.
Okay.
And in transplant, we were always doing something new, learning something new, challenging ourselves on the next frontier of medicine. For me, that was really a lot of fun. And I couldn't get enough of it. We didn't have the internet
I can only imagine
in our pocket, so I'd be in the library at 2 a.m, looking up something. I'd see a patient in the ER and you run back to the library and look up something.
That's crazy. No way.
Well, they used to leave the libraries open 24 hours in the hospital so we could do that.
No way.
There weren't many people in there to join me, I can tell you that. But no, I mean, I like to learn, and I was very interested in the profession. And I think that's what's important too, is try to find that profession that interests you. Of course, take an interest in it and become an expert at it. And I think that can be any of the ancillary professions, the allied health professions, but whatever it is, if you're interested in it, be good at it, you'll really enjoy it.
No, we stress to our community as much as possible the ability to go out there and get that information yourself. So you're saying that self-learning right there. Now, because I would imagine the medical field is always changing. They're coming out with new drugs, new technologies. When that new stuff gets introduced into, let's say, the workplace, how do you go about learning? Is it something that you're required to go learn yourself, or do they come out and say, here's a course on the new drug we just prescribed?
Well, we're required to do what's called continuing medical education, so we have to update our licenses, do all that stuff every year. There's so many things on the internet these days.
Gotcha.
You know what I mean? We have meetings usually once or twice a year also, and then all the new stuff is presented. There's all sorts of online opportunities to get updated in anything new that's coming out.
Right.
Do they teach you in college how to self-learn? Anything along those lines of when it comes out? Is that like any aspect of it? Because I imagine that is the biggest.
Well, college changed it's changed so much since I was there. We didn't have the internet or any of that sort of stuff, So no, you were just kind of, here's your class, here's the book. This is when your exam's going to be. Mm-hmm. It wasn't that any opportunity for that the kids have now. And they're much better prepared. I mean, the amount of knowledge that they have now coming in medical school or even coming into their residencies is so much better than what we had. No, it's different back then, but I think now you have a lot more opportunity.
Okay.
That's like everything right now. With the way technology's going, everything that you need is there.
Right.
It's just kind of taking that initiative and going to find it.
You have to access it.
Before we get out of here, is there anything else? If not, it's totally cool that you would like to add on to for anyone that may be considering going down the path that you went?
I would like to tell them all it's a lot of fun.
It's a lot of fun.
And I never feel like I'm at work.
You don't really?
Yeah.
That's awesome.
You know, I've never felt like since I finished my training that I've worked a day in my life.
No way.
Yeah. I mean, I can imagine one time I'm a little tired coming in. I'm thinking, God, I haven't slept in 3 days. Got to come in and do another transplant. But, you know, it's always been fun.
It's always been something that you've enjoyed.
Yeah.
Awesome.
That's why I recommend healthcare to people. I think it just can be a lot of fun.
And then, like you said before, you don't even have to go to college to be involved within the healthcare industry. There's
Correct.
all those opportunities right there for you.
Multiple elements.
All right. Well, Mr. Forrest, I just want to thank you one more time.
Okay,
It's
pleasure.
awesome. I'm sure we helped a lot of people today. So
Yeah, absolutely.
thank you for that, man.
Sure. Anytime, guys.